Hi, Daniel here. Doing some taping today for runner's knee or iliotibial band syndrome, as it's sometimes called. It's a fairly simple method. It's easy. Just watch the end and how we pull the tape around. I find this method of taping really useful when you're building up your mileage. So if you start getting knee pain, drop back to where it's comfortable, tape this way, and I find it seems to get you through that painful hump. So you run, you get pain. You can either stop and back off or stop completely, but this one sort of allows you to maintain your distance whilst carrying on, so you can then start increasing what you're doing again. It's a really nice way of taping it. It's useful, but bear in mind that you don't want to do too much too quickly, which often is what's caused the problem. It's, tissue fatigue is probably the best way of describing it, or overuse. Now we're going to take for runner's knee, or sometimes called iliotibial band syndrome, or ITT problems, iliotibial tract. This is a pretty easy way of taping once you get used to it. So here I'm using a piece of tape that's maybe 20 to 30 centimeters long, and another piece of tape. This one I probably actually cut a little bit too short. It's about 10 centimeters long. Could go potentially up to 15 centimeters. So with this one, we're going to come up through here, around there, taking the knee joint and part of the ITT, and stop. Sometimes I do find I have to trim this one down halfway through because I've made it a little bit too long, or I've applied maybe a little bit more tension than I want. There we have our anchor. Slap that on. Now we can either tension the knee by bending through there, or we can straighten the leg and apply the tension to tape, so 50 to 80% tension through there, and bring that up through there. And again, no tension at the end. Then we get our other little piece here. As we've done with nearly all these knee ones. Ramp the tension up quite high, pop it across. Here I want it just covering the back there, no tension there. Crossing over the point of pain and coming around like that, almost just to reinforce it. Then use a piece of tape cover, like the backing paper, and rub on there just to get it to stick a little bit better, generate some heat, some friction. Makes the glue a little bit more tacky, so it stays on. So that's taping for iliotibial band syndrome. If you want to find out about more of our videos, taping videos and so on, please subscribe, and it means you'll find out straight away.